Hi everyone. In this clip, I will talk a little bit about silent reflux and postnasal drip. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please ensure to consult your healthcare provider. So silent reflux is a lesser known form of acid reflux, also known as LPR, which can cause postnasal drip as a symptom. In silent reflux, stomach acid flows back up into the larynx or voice box and pharynx, which is throat, and sometimes even into the nasal passages and sinuses, leading to various symptoms, including postnasal drip. Silent reflux is different than GERD or gastroesophageal reflux disease because GERD primarily causes heartburn and affects the lower esophagus, where LPR often doesn't produce typical typical reflux symptoms like heartburn and reaches higher in the throat. When stomach acid irritates the throat and nasal passages, it can trigger the production of excess mucus, leading to postnasal drip. And that is the feeling of mucus dripping down at the back of the throat. So basically, LPR is a condition where stomach acid flows backward into the upper aerodigestive tract, specifically the larynx and pharynx. It's often called silent reflux because it may not cause the typical heartburn associated with GERD, as I mentioned before, and the acid can irritate and inflame the delicate tissues in the throat and the voice box. Now, for gastric juices to travel from your stomach all the way up through your esophagus and into the throat, they have to pass through two important guards. These are your upper and the lower esophageal sphincters. These are the muscular valves that seal off the stomach at the top and the bottom. The lower one sort of separates the esophagus from stomach, while the upper one separates the esophagus and the throat. So normal acid reflux happens when something weakens the lower esophageal sphincter, or LES, allowing the stomach juices to sort of flow back up into the esophagus. LPR happens when the upper esophageal sphincter also relaxes inappropriately. This allows reflux that's already in the esophagus creep up higher into the throat. Different things can affect these two sphincters and cause them to relax. Some of these factors weaken the muscles gradually over time, while other factors can affect them temporarily. Most people have more than one factor actually affecting them. Common factors are various medications and NSAIDs, hormone therapy, coffee, chocolate, alcohol, and more. The symptoms of LPR or silent reflux are hoarseness, the voice changes like a raspy or weak voice, sensation of a lump in the throat. This feeling can cause frequent throat clearing, chronic cough, which there's a persistent cough, especially after eating or lying down, postnasal drip, as we mentioned, mucus dripping down from the back of the throat, sore throat. While this is not always present, it can be a symptom. Difficulty swallowing. In some cases, LPR can make swallowing uncomfortable or difficult. Bad breath. Stomach acid can contribute to unpleasant breath odor. It can also cause laryngitis, which is the inflammation of vocal cords or loss of voice, and frequent upper respiratory infections. Some lifestyle habits can have an impact on these protective sphincters, and things like lying down or reclining soon after eating, sleeping on your back, which submerges the lower sphincter inside the stomach contents, eating larger meals, which expands the abdomen and increases the digestion time, wearing tight clothes or belts around the abdomen especially, and especially when you're seating, when you're in seated position. as well as hiatal hernia, that's when the stomach bulges up through a hole in the diaphragm. Pregnancy, lots of people get temporary acid reflux during pregnancy when abdominal pressure sort of pushes against the diaphragm, and also hormones contribute to this. Obesity is another cause of constant abdominal pressure that can weaken the sphincters over time. It can also affect the hormone levels. And last but not least, smoking, because smoke relaxes the sphincters. So a doctor may use laryngoscopy, which is examining the throat with camera to look for signs of inflammation or irritation. LPR can be misdiagnosed sometimes as allergies because of some symptoms that overlap. However, LPR will not cause, for example, sneezing, itchy eyes, or runny nose. So they also may have to do actually upper endoscopy, esophageal pH test, and more for a more accurate sort of diagnosis. The prescribed medications usually are proton pump inhibitors, or PPIs, or H2 blockers to reduce stomach acid production, but of course they come with their own short and long-term side effects. Some people can solve the LPR with lifestyle adjustment alone. In general, LPR is more likely than GERD to improve without medication, because LPR may be caused by only a small amount of reflux, and it takes time for LPR to heal. So it may take several months before you can actually tell if your adjustments are working. But in the meantime, try to, for example, eat smaller meals, 5 or 6 mini meals instead of 3 big ones. Avoid rich, spicy, acidic foods. These can increase the acid and other irritants in the reflux. Eat dinner earlier. Try not to recline or lie down for 3 or 4 hours after eating. Sleep on your left side. This positions sort of your lower esophageal sphincter in an air pocket above your stomach contents, which reduces reflux while sleeping. Avoid carbonated beverages and eat slowly so you don't swallow air. Also, don't drink with the meal. The liquids can be taken like 30 minutes before the meal or a couple of hours after, not so that they don't dilute the stomach acid, and it allows for proper digestion. Wear loose clothing around the waistline, quit smoking, and reduce or eliminate alcohol consumption. So there's also a combination of vitamins and minerals that can help strengthen the esophageal sphincters, such as zinc, B-complex vitamins, including folate, riboflavin, and B6, vitamin E, vitamin D3 and K2, magnesium complex, which includes magnesium citrate, glycinate, and malate, pre- and probiotics, betaine HCl with pepsin, iberogast, which is a German herbal complex, and ginger. On the emotional and metaphysical side of this ailment, this can show as a reaction to holding on to negative emotions, anxieties, and past trauma. The digestive system is often symbolic of how we process and assimilate information, experiences, and relationships. So this can also be due to unresolved feelings and difficulty accepting a certain situation or truth in life. Practices like meditation, mindfulness, and journaling can help process these emotions and find greater balance. Hope this has been helpful. Like and follow for more. Be the light.